Welcome to Medicine Made General, where real doctors break down real health issues. Whether it's a simple question or a complex concern, we're here to help you take charge of your health with confidence. I'm Katie Cavanis-Crowley, GIM's Communications Specialist. I'm joined by my co-host, Dr. Beamal Asher, Interim Director of GIM. This episode is part 2 of a special 2-part series featuring Dr. Claire Snyder. In this episode, we focus on the power of the patient voice in cancer care and how Claire is helping ensure survivor perspectives are incorporated into every step of the care process. If you missed part 1, be sure to check it out. We talk about how cancer specialists and primary care providers work together to take care of cancer survivors. We pick up the conversation where Claire shares the importance of cancer survivor quality of life.
You've done some work in quality of life in cancer survivors. I wonder whether you could talk about that a little bit.
Yeah, so one of the parts of my work that I'm most passionate about is making sure that the patient's perspective is central to their care. And asking patients about how they're doing is what we refer to as patient-reported outcomes, or PROs. And so going back to definitions, PROs are patients' own reports of how they feel, function, and live their lives. So they include outcomes like symptoms, functioning, well-being, and health-related quality of life. And they're collected using standardized, validated questionnaires so that we can get results that are more structured and better able to inform care than just asking the question, how are you today?
So patient-reported outcomes, I think that maybe is a phrase that some of our listeners might not be the most familiar with. So let's go into that a little bit more. Patient-reported outcomes, or you called it PROs for short. Can we talk more about how PROs help improve care for people living with cancer or after they've had cancer?
Yeah, so PROs have been involved in cancer and actually just healthcare in general for decades. And the traditional use has been in clinical trials. So when you think about comparing treatment A and treatment B, and you might have outcomes such as like survival in cancer, or if you're talking about diabetes, it might be, hemoglobin A1C or whatever. But what the patient-reported outcomes do is they tell us about how these treatments are impacting patients' lives. So in cancer, are they not just living longer, but how do they feel? How much of their usual activities are they able to do? I think, cancer in many ways was a huge impetus to the quality of life and patient-reported outcome field, because we could see, the old treatments were incredibly toxic. And, it raised the question, is the cure worse than the disease? Unfortunately, cancer treatment has come a long way, but it's still important to think about, the quality of life that patients are experiencing, not just the quantity. More recently, what we've seen is, in addition to comparing, treatment A and treatment B on patient quality of life in clinical trials, is incorporating the patient's own voice in a structured way as part of their routine care. So that's me filling out a questionnaire and my doctor and me looking at my results together and seeing, hey, I'm really fatigued and that affects my ability to do my routine activities. Is there anything that we can do about this? And that way, we're not just looking at whether my lab values are going in a good or bad direction, and we're not just looking at an imaging study about whether something is bigger or smaller than it used to be. Because whether something is bigger or smaller on an X-ray or some kind of scan doesn't necessarily affect your ability to, it doesn't necessarily affect how you feel or your ability to do your day-to-day activities. And so I think it's just critically important that the patient voice is part of informing their care.
It's a fascinating thing, and it's basically a tool, it sounds like. And but I wonder, one of the difficulties in medicine is getting those tools incorporated into care. And I'm wondering what has really helped advance the use of these patient-reported outcomes or PROs in routine care.
So I think there have been several developments in the field in recent years. I mean, first is just the recognition and emphasis on patient-centered care. And I think clinicians have always been interested in patient-centered care, but just to lift up that concept and make it a focus of care delivery has been critical. The second factor is advances in technology that have enabled us to seamlessly collect these patient-reported outcome questionnaires and integrate them in the electronic health records so that when my provider is looking at the screen and seeing, okay, this is what your lab values are doing, this is what your imaging studies are showing, but this is what you are telling me about how you're doing. And the clinician can then bring all of those pieces together and use that to inform their care. Now, just like anything else in medicine, pro scores, like saying that my physical function is a 60, is not something that is immediately interpretable by clinicians like BEML. So what we need to do is make sure that we make that number 60 meaningful to them, and that the way we share the information in the electronic health record doesn't just tell him a number, but tells him the implications. And so a lot of my research has focused on how best do we communicate that information to providers and to survivors so that it is well suited to inform the patient's care.
Yeah, you got to make it as simple as possible for people like me.
Yeah.
That's my takeaway from this.
Well, what we've said, when we've talked to people is they say, okay, well, this is what we put together to help explain it to patients. What do providers need? And we say they need the same thing.
Yes.
Like patients and providers need to get the same information, both so that they're on the same page and also so they have a joint understanding of what the meaning is.
Yeah. Well, and honestly, Claire, as I listen to you speak, I would love to touch more on, like, do you have any examples either from like an individual person or across the health system? Can you share, an example of how listening to these patients in this way has changed their care?
Yeah. So, just from a high level, one of my favorite quotes comes from a mother of a child with cancer. And what she said is, when the doctor asks, "How are you?" and you say, "Fine," the doctor thinks he has collected clinical facts while you think you have been polite.
Oh, yeah.
And I genuinely believe that the doctor wanted to know how the patient was doing, but sometimes informal communication is insufficient for collecting that kind of information. And some topics are just hard to bring up. So, it's going to be hard for a patient to answer the question, "How are you?" and say, "Well, due to some of the side effects from my treatment, my sexual function has really been hurt and it's affecting my relationship with my husband." Or like another example is we ask patients about questions about body image if it's relevant. And, seeing the question on the questionnaire was uh, made this patient suddenly realize, hey, this is something that my provider cares about. I never would have thought to bring up like my body image issues, but I did, and he was able to address them, and I feel much better. And I will also say that patient's provider also told us, hey, I was able to help that patient, and I feel really good about that. So you have kind of these conspiracy of silence topics where clinicians won't bring it up if the patient doesn't raise it, and patients won't raise it if the clinician doesn't bring it up. Then there are other topics that it's just harder to diagnose in a brief visit, things like depression and anxiety. But if you have these structured questionnaires and you can see how scores are trending over time, or even, if their absolute scores are bad, it can help identify issues that might have otherwise gone unnoticed. So what we see with PROS is a cascade of benefits. It facilitates patient-clinician communication that leads to informing how patients are monitored and managed, and then that can lead to improvements in symptoms, function, and quality of life. So it's rewarding to see the benefits at every step of the process.
Yeah.
I want to switch gears a little bit, Clara, and something that I just learned about is this. You lead this Proteus consortium, which brings together patients, clinicians, researchers from around the world. I wonder whether you could tell me about your work with Proteus and what you're really proud of with this consortium.
Well, I do appreciate your asking about Proteus, because Proteus is one of the things I'm most excited about in my current work. And what is unique about Proteus is that it's not about doing the research, it's about making sure the research that we have is translated into practice. So we have all this information from our decades of work on the best ways to use PROS in clinical trials and the best ways to use PROS in clinical practice. But so often research results sit on virtual shelves and virtual journals. And what Proteus does is translate that knowledge into resources that are user friendly and enable clinical trialists and health systems to incorporate the findings. And we do this by partnering with, as you said, the key sectors involved, and that includes patients and clinicians and researchers and regulators and industry sponsors and policymakers and payers and the electronic health record vendors and health systems. And so bringing all of these groups together and discussing how we can help navigate the use of patient-reported outcomes, both in clinical trials and clinical practice, has probably been the most impactful and important work that I've done.
Well, Claire, I cannot thank you enough for talking with us. This has been fascinating and exciting. If I may, just one more question while we have you. I would love to know more about, what motivates you? What keeps you motivated to do this work?
Well, I think that my enthusiasm for doing this kind of research is obvious, but it is incredibly rewarding to do research that focuses on what matters most to patients. And the opportunity to do research that I care deeply about and the opportunity to improve the lives of millions of patients is just incredibly gratifying. And I feel so lucky to be able to do this research and to be able to do this research with my fantastic colleagues at Johns Hopkins, both in the Cancer Center and in general internal medicine. And I really appreciate the opportunity to share some nuggets of knowledge with your audience. So I appreciate the opportunity to join you today.
No, this was great. I mean, this
Yeah.
is awesome. Thank you, Claire. I mean, for the important work that you're doing. And, for the future, we know cancer's going nowhere, right? I mean,
Yeah.
cancer's here. So this is great. And I think patients benefit immensely from what you've been doing.
Thank you for tuning in to Medicine Made General. In this episode, Dr. Claire Snyder shared how she's working to ensure that the patient voice plays a central role in cancer care. If you haven't yet listened to part 1 of our conversation, check it out to hear Claire discuss how cancer specialists and primary care providers collaborate to provide comprehensive care for cancer survivors. Until next time, stay informed, stay healthy.